Welcome to All Things Chiropractic, a podcast series where we discuss all of your basic essentials that you need to know about chiropractic and health overall. I'm Dr. Kira. I am the founder and chiropractor at Chiropractic, and today is our first episode of our series, and we'll be talking about the word subluxation and what does that mean in chiropractic and in terms of our health. And to do it, we have our foremost expert, Dr. Timothy Schaub, here with me today. Dr. Tim is my chiropractor. Many of you have asked about who adjusts me, and of course, I get adjusted myself. And this is the man, the magic, the myth, Dr. Tim. So thank you for being here today.
Thank you for asking me to do this with you, Kira. It's an honor for me because you've only been in practice about 20 years, about 2 years.
That's right, yeah.
And I've been in practice about 25 times that for nearly 50 years.
Yeah.
And you have the skills of somebody who's been in practice more like 20 or 25 years. So it's an honor for me to share this time with you today. And it's an honor for me to have the opportunity to get adjusted by you and to adjust you and help more people more.
Yeah.
By keeping you clear and connected.
Yeah.
Which is really what the subluxation is all about.
Mm-hmm.
It's a strange word. To many, it's an unfamiliar word more than strange.
Right.
But if you break down the term vertebral subluxation, it is divided into two parts, sub, lux.
Mm-hmm.
And sub means under, and lux means lit. And what's the name of your office?
Casa Luz, House of Light. Yes.
House of Light.
Yes.
So a subluxation is defined by many practitioners in the medical world and in the chiropractic world as a dislocation of a vertebra, but sub, meaning under, dislocated, meaning not a massive dislocation, but it's considered to be a minor dislocation.
Right. So not like when someone dislocates their shoulder and it's hanging down awkwardly.
Out of your shoulder.
Yeah.
But it's the person that you see whose maybe shoulder is rounded a bit.
Yes. And in that medical definition, going off of that, they usually refer to subluxation as that restriction, right, in juxtaposition to the other vertebrae. So when we look at the one above and below, we see that vertebrae there in the middle of both has lost its normal juxtaposition or movement, right?
Normal alignment between the vertebra above and the vertebra below. And even though it's, we look at them as being minor, a minor thing can have a major effect in the body.
Right.
For example, just so that the people that are listening to this podcast just think about if they've ever gotten a little tiny pebble under their foot, underneath their little toe.
Oh, yeah.
Their little toe is a little toe, but you have a little pebble in the shoe, and now you're trying to walk. Does it cause problems? Absolutely. You can't wait to get it out of there, right?
Sure.
And that's how I feel about subluxations with my patients, your patients, all patients. And so
they got a lot of rocks in their shoes by the time they get to us, usually.
They do.
They're stepping on boulders at that point.
Yes, that's true.
And the thing with that too is that pebble, for example, that pebble of subluxation that we had, which I wanted to define it in chiropractic terms, and a little bit we said medically more or less what that would mean. But I want you to give us your definition. But going back to the pebble, people don't feel it.
Right.
And that's crazy because, as you said, it does hurt. It is there and present, but people actually feel it until they're aware of it. Is that right?
Yeah, my experience has been with patients, with the public, that the public only thinks that they have a spinal problem if they have pain in their spine. Right. They do not realize that such conditions as headaches can be caused by a misalignment of the neck. They don't understand, per se, that pains in the hands or pains in the feet or arthritic issues in a shoulder or a hip are a result of the spine not being in the appropriate alignment, not being in the optimum alignment. And then as time goes on, the blood supply and the nerve supply into those organs or those glands or those tissues or those joints of the body is underlit. It's sublit. And
is that how you would describe subluxation, as a lack of light in the body?
To some degree, yes. I like to define subluxation as an interference to the normal expression of a nerve. So in your spine, in your brain, you have nerves that come down from the brain and run and travel to every part of your body. In Grey's Anatomy, and I'm not talking about the TV show. There's a book called Grey's Anatomy, which is a book.
If you're a chiropractor, you've seen that book.
Yes, and if you're if you're a chiropractor, if you're a dentist, if you're a medical doctor, if you're a nurse, whatever, most healthcare practitioners, physical therapists, osteopaths have read or at least studied Grey's Anatomy. Sure. And Grey's Anatomy is a book of anatomy written by a man named Grey, who said and defines the brain and spinal cord, the central nervous system, as being the brain and spinal cord, and the brain controls and coordinates. That's very important. Controls and coordinates every organ, every gland, every tissue, every cell of the body. So the brain sends messages to your body and tells you that you can do this with your finger. You can do a little squat thrust with your finger when you want to do it anyway. Or you could do this, or if you're in Mexico, you can do this and say yes. Awesome. But in order for you to sense that finger, I have to touch it. Sure. Or cold air has to be blowing on it, or you touch it with a hot stove, per se. And then you sense it. So you have nerves that go into your body and tell your body how to work, how often your heart should pump, how often your lungs should inhale and exhale air. And then you have messages that come back from everywhere in the body, particularly the skin. The skin is one of the most richly embedded organs in the body with sensory nerves. And that's why when you have a little pebble in the bottom of your shoe, underneath your little toe, you know it's there because it's sending a message back to the brain. And it's telling your body to adapt to that. Now you can adapt to it by hopping on the opposite foot, which could then cause a subluxation in the lower back and pelvis. Or you could adapt to it by just saying, I'll push through it and I'll keep going and run your body's on adrenaline and energy that you shouldn't do.
Just become used to the pain.
Yeah, or you could take your shoe off and pull the pebble out, which would be and that's what we do in chiropractic, is we remove that interference or that obstruction in the spinal vertebrae through manual adjusting of those joints, and it feels great. And people, some people are afraid of it because they think that when they hear those snap, crackles, and pops. I had a chiropractor who used to work for me in my office. He used to say, "Snap, crackle, pop. That's how you spell relief," because it feels good, but people think it hurts. And only
just like anything, if you're new to it, and
it's new and unusual to the person that doesn't understand it. And then when they approach you, they call your office, they come in as a new patient, they go, "Oh, that felt good, that didn't hurt at all." But people don't worldwide, globally, to this day, a small percentage of the population utilize chiropractic. Every year, more and more and more percentages of the population utilize chiropractic. But frequently, I find they use it for the wrong reason. They use it because they hurt, because they've allowed an interference to occur in their nervous system, and it's caused them great lower back pain or headaches or neck pain or arthritic pains or
so in other words, they've allowed the pebble to stay in the shoe for a while.
Too long. And maybe they got used to it and they didn't feel it after a while.
Sure. And they think nothing's wrong. So to recap, you said their central nervous system controls everything in our body. Is that correct?
Yes, it controls, and more importantly, it coordinates, meaning it adapts you to your environment. And in medicine, when I say medicine, I mean Western political orthodox medicine. In medicine, I think in general, we try to adapt the environment to the person. Oh, you're allergic to feathers. Throw out your downy, your down comforter.
Or even the climate control we're exposed to so much now. People don't like to be cold. People don't like to be hot, right? And they never allow their body to actually get accustomed to the external temperature.
Absolutely.
Adapt and then
adapt the environment to the person. And in chiropractic, what we do is we through reducing, removing, correcting, or these obstructions or nerve interferences, we allow the body to utilize, to adapt better and to utilize the innate intelligence of the body.
So that's another point that we should definitely touch on.
Absolutely.
When we talk about subluxation, we talk about how to heal from subluxation. We talk about healing from the inside out using what you have just referred to now as our innate intelligence. And this is another chiropractic word, and we could probably do a whole other video on this.
Just on the word innate.
But we'll just touch on it today. So innate then is coordinating and controlling all of our bodily functions on the inside through our central nervous system.
And adapting us as best it can to the environment.
Right. And so can you explain, just so that people know, when we develop that pebble in our shoe, when we develop subluxation, what does that actually mean in terms of our health overall?
Well,
what
in every living being,
can we feel it right when we?
Not necessarily.
Okay.
Not necessarily.
So we may not know when we become subluxated or how we become subluxated.
Absolutely. Okay. Correct. You're absolutely correct. I use the example of somebody that has a heart attack, and I'll ask my clients, what's the first symptom of a heart attack? And they'll say, oh, chest pain, left shoulder arm pain. Sometimes doc, it can even be on the right shoulder, but it's you're going to have a heart attack, or you may have jaw pain, or you may have bad indigestion. Those aren't the first symptom of a heart attack. The most common symptom of a heart attack is, unfortunately, sudden death. The person never had any of those symptoms. Yeah. The people that survived the heart attack will tell you that they felt those things. But frequently there is no symptomatology present. So that's what I was saying. With some people, they'll go to the chiropractor when they have pain, because their experience with the chiropractor has been that if they get themselves adjusted, their pain goes away. Right. So they're looking for the removal of pain, and they make the major mistake of thinking that I, as the doctor, you as the doctor, are the healer, and that we heal them from that pain. But in reality, we
never put the rock there in the first place.
We didn't put the rock there, and we usually don't take the rock out of the shoe. Right. But what we do is
we let them know it's there.
We allow their body the opportunity to balance itself out. And in every living being, whether it's a human, whether it's a dog, whether it's a bird, whether it's a ferret, whether it's an elephant, whether it's a horse, whether it's a plant, in every living being, there is an innate intelligence that tells it what to do. Right. So the word innate itself is confusing to some people because they've never heard it before. But I like to call it something that I think most people can understand better, which is instinct. There's an instinct in the body.
For survival, for your well-being. You cut yourself, it heals. It doesn't, not that it stays open and keeps bleeding. Because then the body maybe wouldn't be as interested in healing itself, and we would need more external, right, support or yeah, help from the medical system to help cover that up and heal us. And that's that fixing model. No, my body can't do it itself. But it's funny because we operate a lot of our healthcare off of that fixing model, that we're going to look at the parts, right, instead of the sum of the parts as a whole, look at you holistically. Contrary to that, they'll look at a symptom at a certain part and try to fix that part. But the very fact that we have this innate intelligence that you're describing, which is a term that we commonly use in chiropractic, that more people should know about, we should say it more often. Yes, this is when you heal from that cut, you know, who can we credit with that with? Well, innate intelligence.
You're absolutely right.
That's what
That's
is.
it.
Like, and so in the same way, could your innate intelligence heal your subluxation, as we talked about? And when we refer to subluxation, just to be clear again for the people, what are we referring to? Is it just in the spine? Is it in different joints, areas of your body? Well, where can it occur?
A vertebral subluxation is a misalignment of the vertebra on top of the disc on top of the vertebra. So you have 33 vertebrae in your spine. Most people have 7 in their neck, 12 in their mid-back, or what we call thoracic or dorsal spine, and 5 in the lumbar spine. Then a triangular shaped bone at the bottom of that everything sits on, called the sacrum, which fits into the pelvis and hip joint. And if you have a misalignment of those vertebrae, the nerves that come out there go to each individual nerve goes to a different set of organs, tissues, cells, and glands. So some go to the thyroid, some go to the eyes, some goes to the ears. When you think about it, this is where your nervous system goes. Particularly the first bone in the neck, which is called the atlas, and that's the only bone that some chiropractors work on, which is fine.
Yeah.
The first bone in the neck houses the brain stem inside of it, and the brain and that area of the spine controls the eyes, the ears, the nose, the throat, the mucous membranes of the sinuses, in the front of the head, in the back of the head. People think they have just 2 sets of sinuses. They think they have their frontal sinuses and their maxillary sinuses, but you have hundreds of little sinuses in the back of your head as well. It controls the actual motor movement of the hands, the forearms, the shoulders, the arms. It controls the tonicity of the legs, the buttocks, the abdominal muscles, and it controls the nerve supply into your gallbladder, your liver, your pancreas, your small intestines, the first half of your large intestines, and a couple of other non-essential organs like your heart and your lungs. Nothing too important. Nothing too important. It controls everything in your body and adapts that. So, so your heart, for example, will change its mechanism of action and beat differently when you're under stress than when you're not under stress. And that's a good thing. But if the body is hung up by certain particular medications that may make the heart beat in a faster method or a slower method than it should, and then those medications can actually confuse the body when the body's under stress, and then you can have more problems. So it controls everything in the body, but most importantly, it adapts you as an individual to your environment.
Yeah, and that reminds me of this little diagram that we saw. I don't know if you're familiar with it, but there's 2 little fish bowls, right? And you have the fish, or maybe there's just one. I don't remember how it goes exactly, but there's a fish for sure. It's in the bowl, and the water is dirty, right? And that's it. There's there's one fish, one bowl. But there's two methods, and the two methods that we're talking about a little bit is that chiropractic is obviously an independent healthcare profession. So we operate with our own distinct and unique philosophy, art, and science. Those are the three pillars of chiropractic. And so the two methods going into this fish bowl, one was well, the fish is dying, the water's dirty, right? So the fish is not able to adapt to its environment. One person doesn't want to clean the bowl, they just want to inject the fish. They say, if we inject this fish with some medication, maybe it'll get better, but they never look at the environment, which is obviously stressing the fish, considering it's dying because it's in a dirty and non-cleanly environment, right? The bowl needs to be cleaned, and that's the other route then. Well, I'm going to clean the bowl, and then the fish should be healthy because we've taken away that stress. And so in the same way, is that how it works with chiropractic? If you take away subluxation, is that helping that person in their life to not have some of those symptoms?
Oh, absolutely.
Or pains or illnesses that we spoke about?
Absolutely.
Maybe even prevent that heart attack or something else. Let's say you have a subluxation that's interfering with the part of your nervous system that goes to the heart. Could that, in the long run, create symptomatology there?
Absolutely. In fact, it creates the symptomatology. It creates the problem right directly in the spine itself. If you have a vertebral subluxation that occurs at an early age in life, it can occur when a baby falls off of a coffee table. It's climbing around the coffee table. It doesn't know that it can fall yet, and it lands what I call jelly side down. The peanut butter and jelly sandwich. How does it land when it falls off the kitchen counter? It always lands the jelly side down, right? Mm-hmm. So it lands bam right on top of its head. It causes a dislocation, however minor or severe, to the neck and to the neck vertebra, and then inside of that cord, surrounding that area, there's a bruise that occurs in the spinal cord itself. And then it's a black and blue, just like if I punched you on your arm, you'd have a black and blue mark here. Well, there's this black and blue mark that occurs inside of the spinal cord itself, and that causes swelling. That causes the nerves in that area to do something different than what they should optimally doing. And then, unfortunately, in today's society, mommy or daddy or the babysitter at the Leering Center picks up the baby and brushes him off and says, "Oh, you there, little Johnny, you'll be all right." And when the baby stops crying, the issue has not been resolved. The baby just stopped crying. Sure. So the vertebra is still out of alignment. Left uncorrected, they don't take the baby to the chiropractor. They don't have the baby checked. They don't get that vertebra lined up to the best that the chiropractor could correct it. Mm-hmm. And then there's going to be a continual either overactive, overfunctioning nerve coming out of that area of the spinal cord, or an underactive nerve coming out. And then the body has to adapt to that.
So subluxation would create an imbalance then. Subluxation creates imbalance. Is that right?
It causes
within the functioning of the nerve.
It causes a dysfunction of the normal expression.
You don't want them too much heightened function. You don't want them too diminished.
Correct. Yeah. Okay. Correct.
Mm-hmm. Yeah, that makes sense.
And also in that area of the spine, when it's not in alignment, gravity is always throwing its weight around. Gravity only falls one way, right? It drops from above down.
Sure.
And so as that gravitational stress occurs on a joint, which is now out of alignment, then that disc between those 33 movable vertebrae becomes deteriorated, mm-hmm. and the vertebrae themselves begin to change shape. They go from a nice rectangular, boxy type body of the vertebra, they begin to form to the disc, because that's the body's innate intelligence trying to protect the joint and the disc from becoming worse. and then you eventually develop osteoarthritic changes in the spine, which wakes people up with stiff necks and causes them to have other problems with mobility and motility. So
your body's going to adapt, yes or yes, but depending if you are clear of subluxation or
Right.
not will depend on how well it adapts. If it's a maladaptation, we say, so if it has those kind of degenerative changes or not.
Right. So the beauty of chiropractic, it has a life-giving effect. It helps the body adapt in the most appropriate way so that the body can heal itself, because we don't do the healing. The patient's body innate does the healing. The patient's instincts do it.
100%. Yeah, absolutely.
Nobody faxes a message to the Canadian geese when they're flying south to Florida in the United States every fall and says, "Okay, geese, it's time for you to take off."
Yeah.
And then when spring comes, nobody faxes them a message to go back. There's no geese fax headquarters. There's no AI for geese. They just know that that's what they're supposed to do. And we as human beings know, when we're babies, we don't ever think about it. We're going to grow and we're going to mature. The first few years of life, we call it maturing. The last few years of life, we call it aging. And the bottom line is that the public itself has been marketed to by the pharmaceutical industry and told that they've been told a lie, and that lie is that as you mature, as you age, you should somehow become, as you age chronologically, you should somehow become physiologically weaker and sicker and less mobile.
Less capable.
But I have seen with patients who come in to me in their 20s or 30s, and I treat them for decades, that as time goes on, they become healthier and physiologically younger while they're growing chronologically older and stronger and fitter and in better health than they were when they were younger.
Right.
And this can happen at any age.
Right.
It's never too late. That's the name of my book. It's never too late to regain your optimum health, no matter how young or how old you are.
Yeah, and we'll link that book so that you guys can read it. But that's 100% correct, and that's honestly such a popular topic and such a popular fear right now in modern day society, in our modern world, is the aging crisis.
Oh yeah, and people now think
it's
that
a crisis, but it's always happened. That we weren't as stressed about it before.
People think that they're old at 30, or they think that they're old at 40.
Well, do you think it's because they physiologically feel much older than they should?
And that's because a lot of them have never experienced chiropractic care. They have never used chiropractic care to improve their optimum health. They've used it, if they have used it, they've used it just to get rid of pain. And then discontinued care, because that's the model that the medical profession has presented.
Right.
That there's
that doesn't
an
work so well.
event, there's an event, and then there's a treatment, and then the event should be gone, and then you go on until you get another event. But in reality, I mean, we are moving, living, breathing, stressed individuals all day long. So all day long, all week long, all month long, all year long, all decade long. For some of us, there's been decades that we've been under a tremendous amount of stress. So when you get adjusted and you upregulate that central nervous system, the body works better, gets younger, gets stronger, gets fitter.
Wow, that's huge.
So some people think, but most people don't get enough exercise. Most people sit too much. Most people, I'm being generalized in these things,
Yeah, absolutely. Our lifestyle has definitely become more sedentary over the years. Maybe we can all agree on that.
And the food, we've been lied to about the foods. We don't get necessarily fresh foods anymore. We get food products. We get food products, things that have been, I say in the United States, you have the FDA, the Food and Drug, and I always like to emphasize the fact that it's a Food and Drug Administration, and they've turned many of our foods into chemically processed drugs, and we get addicted to them. They have flavor enhancers in the coffee at the biggest coffee establishments in the globe. And so
those would add at this
stress,
point even more
stress to the liver, and if the liver is stressed, there's a nerve that comes back from the liver that goes into the spinal cord and causes the vertebra.
Subluxation.
So the subluxations can be caused by physical traumas, like the baby falling off of the coffee table and landing jelly side down on his head. It can be caused by the birthing process alone. It can be caused by chemical traumas in the environment,
like the food you eat, water you drink, air you breathe, kind of thing.
Indoor and outdoor air both. Water has been, in certain areas of the world, like where you live and where I vacation a lot, it's very, very hard water. Where you go to another city like New York City, the water is very, very soft. Each have their positive effects on the body, and each have their very negative effects on the body. So food, water, air, medications. People will come into me and I'll say, "Are you taking any medications?" They'll say, "Oh no," and then I start asking. Then I find out that they're taking Synthroid for their thyroid, and they're taking birth control pills for their sexual activities. They're taking antidepressant drugs, but they've been taking them for so long, even at a young age, that they don't even think of them as being drugs anymore.
Right, they're part of them at this point.
They're like their food.
Part of their lifestyle.
It's part of their lifestyle.
Sure. So your lifestyle can determine how subluxated you are.
Absolutely. Yeah, for sure. It does. Because the other component, you've heard of the term carrying the weight of the world on your shoulders, and not to mention, cell phones.
Oh yeah, which we'll talk about in another video as well.
Well, one of the
it's
one of the major subluxations today is and they're even finding these arthritic changes that have been caused by vertebral subluxations that have not been corrected in 5, 6, 7-year-old children today, because they have devices and their parents give them devices.
That's causing a constant stress on their spine, especially within
and
the
it's neck. Affecting their eyes, and it's affecting, your eyes are the central part of your central nervous system. So it's causing cataracts younger and younger and younger every year in people.
Wow.
And yet they tell you that, we're living longer and healthier, but they don't tell you that the reason why some of the people are living much longer today is because they're on life support in a hospital or a nursing home. And their quality of life is not optimized. They're just existing, but they're not living.
And I think that's one of
their fullest.
That's one of my favorite points about chiropractic. That's what gets me pumped up and excited and passionate, that we've been gifted this life. We were born, right? We have innate intelligence. We developed in our mother's womb without her having to say, "Oh, now make a brain, now make a left arm,
now make a thumbnail."
Yeah. So we got intelligence within us, and it's just such an empowering viewpoint to utilize chiropractic in a way that helps you not to just survive. It's the distinction between surviving and thriving.
Yes, absolutely.
Surviving and thriving. And to be able to actually thrive, a lot of people don't even know what that feels like. They've never even, you said, people have just been chronically stressed, chronically working from their living through their adrenal glands, through their sympathetic nervous system. And these are topics that we'll go into later, but they don't even know what it feels like anymore to truly be living and functioning and operating at their fullest potential. And chiropractic has the ability to give them this, to not we're not giving anything they don't have. We're just restoring it.
We're taking nothing out of the body.
Right. We're not bringing anything new to the game.
We're not saying that for some ridiculous reason, God gave you too many organs and we're going to take one out so you can sometimes become healthy, which is what, some surgeries are.
Yeah.
And not that there's some very necessary times that surgeries need to be done, but
absolutely,
we take out body organs in medicine, and in medicine we put toxic substances that really are not particularly healthy for the body in, and you're somehow supposed to become well. Chiropractic is practicing basically body ecology.
right.
We put nothing into the body, take nothing out. We just allow the body, we assist the body in allowing it to become more healthy
by nature.
Healthy by nature.
Yeah,
that's
100%.
good. That's
Well,
good.
Healthy by Nature is a really good book as well. I think Daryl
Healthy by Nature.
Crane, I'll have to look it up. Hope I didn't say his name wrong. Yeah, we'll correct that. But yeah, no, definitely, 100%. Thank you so much for talking today, Tim. I think that was really great.
pleasure.
I hope now that people understand when they hear the word, if they hear the word subluxation, because you'll definitely hear it from me and you'll definitely hear it from Tim if you come get adjusted by us. But hopefully, if any other chiropractors are watching this video too, this inspires you to start using this word subluxation within your practice again. Has it become this term that people tend to tiptoe around? Yes, but as you can see, as we discussed today, it actually has a very simple meaning, a purpose, and a truth to it. So it is important that you, as the public, know what this is, because more likely than not, you've got it. Mm-hmm. Right? You're subluxated, and as chiropractors, you want to.
And you need to be checked. You don't necessarily have to have a pain.
Sure. It's
Just,
not the lack of symptoms, right? That doesn't equal wellness.
No, it does not.
Yeah, yeah. And I think that's a message that we need to get across a whole lot more in today's world with this product and that and selling and marketing, all these things. It gets so convoluted with so much stress about what to choose and why. And I think it's always nice to bring it back to these simple, not so simple terms, but hopefully you're more familiar with it now. Subluxation, as you can see, and as Tim expertly explained, it's not too complex for us to understand why we would develop it and then how we would go about treating it. So thank you so much again, Dr.
You're welcome, and my pleasure.
This today.
It was my pleasure.
Thank you.
Go help people heal.
Yeah.